We hear the latest on locating those missing COVID-19 patients. NIB ups its customer service game, and a decades-old restaurant bows to pressure. Good morning, everyone. I'm Akush Lopinder, and this is the Morning Edition. The only figure climbing in the local fight against COVID right now is the number of tests completed. The most recent dashboard puts that number at 1,977, up from the 1,972 a day earlier. This while the number of confirmed cases sit at 100, deaths at 11, the recovered at 46, and hospitalized at 6. Now, at last report, officials still had a problem finding 13 to 15 people placed in home isolation. An app was to come online yesterday to help better monitor this group. Our Lloyd Allen this morning spoke with the Deputy Chief Medical Officer DeLon Brennan in terms of the inroads being made in this regard.
The app is working fine for those that were able to load it. We are having some minor challenges when it comes to people being able to load it onto their smart devices, having data available to them. So those are some challenges that we anticipated. And so we're trying to get, to make sure that they have the ability to add more data to their system. So we are connecting with our telecommunications partners to make sure that that happens, making sure that we walk them through the process. So, these are some of as you're piloting these types of projects, these are some of the issues you have to anticipate, and hopefully we'll be able to overcome them as more and more persons are added to the system.
Also, as we talk about quarantine, are there any inroads on tracking down those 12 to 15 persons not located by health teams?
Those persons, we did have some luck in trying to find, the majority of those persons. They were healthy and they were able to be discharged from quarantine. So we feel very comfortable that our measures of in-person going to look for people as opposed to merely calling them on the phone has reaped some benefits.
Another question. Repatriation flight set for Friday. We understand that the group coming in comprised of a diverse grouping of citizens, residents, and permit holders. Is this a safe move by the Bahamas considering the success of controlling COVID-19 on the local front to date?
So far, it has been successful. We've had 4 repatriation flights that have come into New Providence thus far. We have groupings that have already been discharged from quarantine that we have, been able to keep track of for the full 14 days. They've all been asymptomatic, and realize that all of these persons that when they come, they are being monitored very closely. The overwhelming majority of them have been able to access testing even before they came. And we know that they weren't shedding virus at the time. So when they're here, we continue to monitor them for the entire time, and it has turned out very well. So I think the manner in which we're doing it is providing very safe and a reassuring approach so that the Bahamian public should feel comforted by we're not taking chances and going to reintroduce COVID into communities where COVID is currently either on the decline or isn't known to be there at all.
And just a follow-up question based on what you said just now, are there any groups of persons outside of our borders who have not been approved for repatriation?
Yes, there have been persons that have not been approved. They either weren't able to access a real-time PCR test, or their PCR test was, more than a month ago, or times like that, and it just was too far to feel safe. That we were not going to be able to put them in a position where we could assure everyone that we weren't putting them at risk. And so we have asked people to get the appropriate test or get a repeat test. So that definitely has happened.
And transitioning back to the local front, any significant developments in Bimini? We are hearing that the 2,000 residents have had their needs met, but have there been to date any indicators of continued spread on that island?
No, what we have continued to do, even during the lockdown, is make sure that we monitor for symptoms and seeing if people are showing up with any challenges, especially those who have been known to be in contact, especially close contact household members and the like, with the cases that have been previously identified in Bimini. And thus far, we have not seen a spike in numbers of persons who either started to have symptoms or have identified as contacts with those individuals. So for the most part, the activities in Bimini and the restrictions appear to be working very well. Once the time period has passed, we'll do another round of some testing, especially for those, again, that are in households that may have been associated, and we'll see what the results of that lockdown have been able to produce for us.
Dr. Brennan, as always, thank you for your time.
Thank you, Mr. Allen.
For the morning edition, Lloyd Allen, ZNS Network News.